Coming up on Why Should I Trust You? Which of these statements hits more with you? The Centers for Disease Control is under attack. It's being gutted. Lives are on the line. Or the CDC failed us miserably during the pandemic. And since then, America has only gotten sicker. The time for wholesale change is now. Well, whichever one rang true for you, that wholesale change is underway, whether you like it or not. Secretary Kennedy says the CDC should just stick to infectious disease. Leave everything else to another group, all while more changes are coming. So, are we in a moment of necessary, reasonable, and long overdue reforms? Or the dismantling of America's public health infrastructure? All this as trust in the CDC has been tanking. Today, we have not one, but two former heads of the CDC joining us, Dr. Tom Frieden and Dr. Mandy Cohen. We want to discuss the seismic changes currently underway at the CDC, but we'll also talk honestly about what needed to change and how we might all be able to gain back trust in those three letters that for decades stood for scientific excellence and cutting-edge health. Let's get started. Welcome, everybody.
Hello, everybody.
We're back.
We are back. So, look, so many podcasts that are focused on trust in public health, science, medicine, they would have one former CDC chief on, but not us. Today,
overachievers.
We have two. To quote the late, great President John F. Kennedy, we do podcasts not because they are easy, but because they are hard.
Yes.
It should be a really good conversation. We're going to be talking about trust in the CDC, what's currently happening there. We're going to get to all that in a minute. But, before that, we've had a great response after asking you guys to spread the word to the research community, which is facing deep cuts or has endured deep cuts to scientific research right now. So much of it, as we're seeing, squarely in line, a lot of it squarely in line with the MAHA agenda. And we've been asking scientists and researchers of all stripes to share their story with us. We're calling it I Was Just About To, that you were just about to do something when your grant was frozen and your research was stopped in its tracks. And we're hoping that by surfacing what's being cut right now, we can have a better, more informed conversation as a country about what our priorities are. So please keep sending us your stories. We want to keep collecting more of them. We're going to read some of them out loud here. Send them to questions@whyshoulditrustyou.net. In general, if you want to say hi and kind of tell us your deep thoughts, do reach out to us. Look, we have one more note to get to before we dive into today's episode. Last Thursday, we had the opportunity to sit down for a conversation with Zen Honeycutt. She is a force of nature in the MAHA world. She is the founder and executive director of Moms Across America. We did learn over the weekend of some tragic news. Zen's son, Ben, passed away. We are devastated for Zen and her family. We wanted to say we are thinking of them and wishing them peace and strength in this absolutely devastating time. Guys, I've texted with Zen a little bit over the last couple of days. She is thankfully surrounded by just a tremendous support group. And, if you do want to learn more about how you can support her, express your sympathies, please go to the Moms Across America's Facebook page and you can take a look there. So our hearts go out to Zen. We're thinking of her. Yeah. Always tough to transition out of news like that, but we are going to now get to our topic at hand. As you probably know, the CDC is undergoing a huge reorganization with deep cuts and layoffs and a major reimagining of its very purpose. So how did we get here? Why is the home of those super scientists in the moon suits, the ones who go into the hot zones, getting reorged and downsized? How is this part of a mission to make America healthier? And is this perhaps the right route to take? What changes were needed, desperately needed, according to a whole lot of critics? And is there still a way to steer this transformation in a way that actually rebuilds trust? We'd like to think the answer is yes. Before we're joined by Dr. Frieden and Dr. Cohen, two former CDC directors, Tom, why don't you kick us off on how we got here with the CDC?
Yes. All right. Question for everybody. Who watched Walking Dead? Any Walking Dead fans? Ooh, Maggie.
I really wanted to, but it scared me, so I didn't.
Oh, you got to go back and watch it. It's good. Okay. So the season 1 finale, and I'm not going to give too much away, but the season 1 finale has Maggie.
You're giving the finale. You're giving it away.
Well, no, season 1 finale.
There's so many seasons. You're fine.
Exactly.
Okay.
The premise is there's a zombie apocalypse. Oh. And we have this band of survivors who are on the run trying to survive the apocalypse. And they hatch a plan to head down to the CDC headquarters. This is the place that will have the answers, maybe a solution to, this hellscape that they're enduring. So They trek down to the CDC headquarters. And the first thing is like, the headquarters are so high tech. It's like this fortress. There's like there's guys like talking to AI. This is like years ago.
I
right,
just
Maggie?
have to jump in. I've been to the CDC and I love the vision of it. I think that's a beautiful place for it to aspire to be, but that is not accurate of what it's like today. Or
right,
in
so they go down
2010.
they go down this like crazy high tech headquarters looking for salvation, and they find one doctor there. There's one guy left. Everybody else has fled. I won't get into too much more detail, but he is alone trying to solve this thing, this crazy, pathogen that's like set the Walking Dead into motion. And the generators are going, and all of a sudden they realize that when the generator dies, the whole place is going to self-destruct because they've got like stored pathogens there they don't want to get out. So the whole thing's going to blow up. And so what was their salvation, the CDC, suddenly becomes like a death trap, and they've got to flee from the CDC itself. And they literally sprint out of the building. You see CDC in the background, and then they dive down for cover, and the whole thing blows up. So,
my goodness.
Well, that's such a bright.
I know. Is this a comedy?
It's a comedy, right? So
It's a comedy, romance. No,
right. Years ago, but then we kind of had our own apocalypse here. The polling that we're seeing out of places like KFF find that now, today, Americans, like fewer than half of us, have confidence in the CDC to carry out even its core responsibilities. They say just about 3 in 10 say that it can act independently without being influenced by outside groups. Like a lot of this now is a change after we had our disastrous experience with COVID, and trust in what was the CDC has collapsed.
So, the makings of CDC did not start in Hollywood, but they did start in 1946. Let's go back and cover some of the basics about what all this is. So the CDC right now tracks the deadliest diseases and figures out how we can survive them. That's just one aspect of the CDC. That's often what we hear about, but there's a lot more that happens there. So like I said, it started back in 1946. They had a really small crew that worked on, this really exotic disease called malaria. And, back when the world was simple, we were just battling malaria. It was set up in Atlanta because, Atlanta sits in an actual hotspot for mosquitoes. And from those early days, the place grew into what we now call America's premier health agency. It didn't officially become known as the Centers for Disease Control. That's what CDC stands for until 1970. But, like I said, it tracks the deadliest diseases. And the other thing it does is, and that's just really one small aspect of it. The rest of it is how we all live healthy lives. Where does a lot of that information come from? It comes from the CDC. There's even a weekly report. It's like a thrilling magazine. It's called the MMWR, Morbidity and Mortality Weekly Report. Just kidding. It's not that thrilling.
I was going to say, like, it is. No, I love this. This is the marketing.
The Hollywood. Yeah. But some people will call it must read journal for doctors and public health. And look, we don't read it every week, but it is a place that we go to, especially when times are crucial and we really want the latest breaking news for these outbreaks and things like that. But, besides these outbreaks, the CDC quarterbacks America's vaccine system. We've already heard about the ACIP committee, and that's the committee that, has independent experts who advise the CDC on vaccine policy and who should get the vaccines. And, we did a whole episode on that. Some news about that this week is that right now they're trying to even remove some of the groups that traditionally would participate in these meetings and give information. Things like, the American Academy of Pediatrics, the AMA. And, those groups have been labeled as, bias. And so they're trying to even remove those from participating in this new ACIP committee. And a lot of, doctors have a concern with that. But, there's also the database about vaccine side effects. That's one of those databases. The home is the CDC.
That's such a hot, we've talked about this before. That's such a hot topic, the VAERS system.
Yeah. And, there's criticism that the way that it's, used doesn't really track all of the side effects. It might be missing some. The other side is, just because you report something to that database doesn't mean it's actually a causal link to the vaccine. The other thing about the CDC is it's almost like a clearinghouse. Like all this money comes in like a bank, and then it disperses some of the funds to your local health departments. Roughly half of the CDC's budget goes straight out the door to fund state and local health infrastructure. Those local health departments are doing disease surveillance, going to doing educational things, going to hospitals, laboratories, and doing things, on the ground in the local places where it matters. We have the big things like chronic health issues and diabetes. The CDC researches all that. There's something called NIOSH, and that was a big thing that got cut, and some of it has been reinstated. But that's a part of the CDC that conducts research and makes recommendations on, how do you prevent workplace injuries and illnesses and deaths. They do run these high-level labs that are, containment labs. And when there's an outbreak abroad, the CDC deploys all these investigators to help save lives and stop the spread. So the CDC has a huge swath. One of the other things that it does that we haven't really talked about a lot is, talk about health disparities and health equity. And that's something that really has drawn a lot of attention because that's been targeted as something to eliminate. But really, the idea of making sure that everybody in the public has equal access to health is a big part of the CDC's research as well.
Yeah. So for 75 years, like the CDC was just like humming along. It was expanding into all these areas that Mark touched on. And then bam, the pandemic hits and the wheels writ large come off the bus for America. One piece examining the CDC's response to the pandemic wrote, quote, "The technology was old, the data poor, the bureaucracy slow, the guidance confusing. The coronavirus shook the world's premier health agency, creating a loss of confidence and hampering the U.S. response to the crisis." At the outset, I think a lot of us remember this. When time was critical, the CDC failed to launch a reliable COVID test, which meant early on, America was flying blind. We didn't know for sure how many cases we were dealing with. Remember this when we learned that the CDC still uses fax machines to get get data from the states, which was just like, what? What are we talking about here? The CDC put out guidance to the public, put guidance out to the public health. At times it was confusing. They flip-flopped on things like masks, on who should get tested. They were slow on nailing down and getting the word out about how COVID even spread. It just was a rough time period for the agency.
I'm truly struck when I look back at a lot of things that were said, like one former health agency official referred to CDC's performance during the pandemic as, here is an agency that has been waiting its entire existence for this moment, and then they flub it. It is very sad. That is what they were set up to do. And the pandemic really brought to the surface a lot of critiques of the agency. I mean, I was hearing it in the lab I was working in. Everybody in my family outside of science was feeling this. CDC was being called risk averse, perfectionist to a fault, unable to react quickly, bureaucratic and hierarchical. And so there's no question that this chapter was really a devastating blow to America's trust in the CDC.
Yeah, and there's another kind of thing to factor in here. At the time there was reporting that the Trump administration was angry and mistrustful of the CDC throughout the pandemic. They were thinking the agency was, intentionally leaking things to undercut the White House's position, which was like, get the country up and running and open as soon as possible. And the reporting that we've come across even went as far as to say that, the agency was seen by some in the administration as being like deep state. So, we know that is a real black mark in the eyes of a Trump administration, to be part of the deep state. And that's where the CDC found itself as it was rolling through the pandemic.
Yeah. I mean, just even listening to this, it's a real shock and almost a blow to what we had expected out of the CDC. And, at the same time, it was, there are a lot of good people there, and they're, at subject to the logistical issues and the big government type of processes that you have to go through even to get something published. And, there's just a lot of bureaucracy. And so now we're in 2025. And now there's a reckoning, and that is already underway. Just turn on your news and you will see it. Read it anywhere you find news. You will find out. So on March 27th, Secretary Kennedy announces a major reorganization and cuts of HHS. It was huge. It was a slashing of staffing. He called the bureaucracy pandemonium with competing fiefdoms. So Kennedy said his reorg is about cutting waste and redundancy and streamlining and this whole alphabet soup that we keep hearing about of departments that will be folded into a new organization called the Administration for a Healthy America. So he wanted to take a lot of what the CDC was doing, reorganize the people, and do it under a more direct watch of his. So overall, the cuts and reorganization are in line with his goal of shifting more towards chronic diseases and less to infectious disease. So, HHS lost a lot of people, but specifically at the CDC, they lost 2,400 employees, or that's about 18% of the workforce. And some core functions were stripped away, things like work on asthma, disease transmission, HIV prevention, maternal health, workplace safety, like we talked about. A lot of that got cut down or shifted out of the agency to elsewhere. So some of those groups were said to be moved, en masse to this new administration for a new administration for a healthy America. Kennedy said that, quote, "We will refocus the Center for Disease Control and Prevention on its core mission of outbreak response and preparedness. We will also combine multiple offices across HHS into a new administration for a healthy America dedicated to disease prevention and fighting chronic disease. I did not come to Washington, D.C. to be a bureaucrat. I came here to drive change and to team with President Trump to improve and save the lives of countless Americans," end quote. Then we have another phase, DOGE, and the DOGE Acts follows. And now, it's really time to put some teeth into this. The CDC is ordered to cut 35%, or about $2.9 billion, from the money it spends on its contracts. So a lot of these contracts were canceled. So even though they weren't directly CDC employees, their contracts were canceled, so they couldn't do the work. And finally, remember how we said the CDC helps fund those state and local health departments? Well, a lot of that money also was halted or frozen in a way to just either claw back, stop money from going out. $11.4 billion of mostly pandemic-era grants were in that category. These funds had become critical lifelines supporting everything from mental health services to disease surveillance. There was a lot of outrage about this, and some of these have faced legal challenges. In some states, the CDC grants make up half of the local health department budgets. And so for infectious disease response, that number climbs to 80%. A federal judge has temporarily blocked the cuts while the case proceeds, but the future of this funding and the infrastructure it supports is very much in doubt.
Yeah. And throughout all this, really up until last week, there was no official CDC director. There was an acting director. But, Kennedy is basically leading the agency on top of everything, that he's doing with the overall agency at HHS. A big move was the end of May, when Kennedy and his team posted a 1-minute video on X announcing that the CDC would no longer recommend COVID vaccines for pregnant women and healthy kids. He said there's no evidence healthy kids need it today, and most countries have stopped recommending it for children, the team said. There was an infectious disease expert at the time with the CDC who basically left the agency soon after. She said, quote, "Nobody from the CDC who does COVID vaccine policy was involved with that decision or that announcement. And what he announced and the changes he announced completely undercut the very rigorous and very science-based process that the CDC has for making official changes to the CDC recommendations." 2 weeks after that, Kennedy fired all 17 of the CDC's advisory committee on immunization practices. This is ACIP, which we mentioned and have done a whole episode on. He said that they were compromised with conflicts of interest. He didn't provide evidence of that. But that move quickly, he quickly moved to replace a whole bunch of those members with new members. We talked about the KFF poll at the top, and then we mentioned just 59% of Americans trust the CDC to give reliable information about vaccines was another finding from that poll, which is just really staggering, and a change in our sort of our landscape right now, that only 59% of Americans trust this agency to tell them reliable things about vaccines.
Yeah. And Tom, I want to just say that, that for us in the conversations we have on this show, it is very clear that amongst folks who are a little bit more skeptical of institutional science and public health, maybe since COVID, they don't trust the CDC. COVID really changed their opinions of the CDC. Yep. Like the NIH cuts are actually, they're a little bit more mixed on that than they are on CDC. Like CDC is an agency that they really feel like deserves to be completely like wholesale change. So I just want to kind of put in that little piece of detail that we're hearing from the folks.
Yeah, it's a really good point.
I think a lot of that, though, Brenda, is because the CDC is one of these organizations that's very public facing. So before a lot of this, you didn't pay attention to, HHS and FDA and, NIH, but the CDC, people would stand in front of the podium with that CDC logo. I mean, I don't know. People recognize that. And that was a lot of our COVID advice was coming from the CDC. So it's like they bore the brunt of all of this. But there's one more development we need to take stock of here. The CDC, as of last week, now has a director after months without one. The Senate approved Dr. Susan Monarez to lead the agency. It's the first time the position needed Senate approval. That was after a law that was passed, I think, in 2023. And it's an example of how the lines are being blurred between medicine, science, and politics. So now the agency has been pulled into the political realm with, having to go through like a Senate confirmation hearing. So Monarez has 20 years of government experience. She's a PhD. So she's the first non-clinical doctor, non-doctor. She is a doctor, but non-clinical doctor, MD or DO, in more than 70 years to do the job. She's had the backing of RFK Jr. And interestingly, at her confirmation hearing, she said she did not believe that vaccines cause autism or that mRNA vaccines are inherently bad or dangerous. So she does deviate a little bit from some of those points. The thing about Monarez, and I've talked to, people inside the CDC about her nomination, even before she was, considered, and they were very hopeful that with somebody like her at the helm, that science was going to be a core in the decision-making process. So even though we're in this arena of, appointees that are very controversial, she's gotten support from all camps.
Okay, so that's the new boss. And when we come back, we'll be joined by two of the previous CDC bosses to talk about all of this. We'll be right back. Okay, welcome back. We are thrilled to welcome to Why Should I Trust You two former CDC directors, Dr. Tom Frieden, who served as the director of the CDC from 2009 to 2017 under President Obama. He has a book coming out this fall called The Formula for Better Health, How to Save Millions of Lives, including your own. He is president and CEO of Resolve to Save Lives. Welcome, Dr. Frieden.
Great to be with you. Looking forward to the conversation.
And we have Dr. Mandy Cohen, who headed up the CDC from 2023 to 2025 under President Biden. Prior to that, she was North Carolina Secretary for Health and Human Services. Today, she serves as National Advisor for Manat Health. Welcome, Dr. Cohen.
Great to be here. Thanks for having us.
So, look, the most natural place to start this conversation would be to ask you about, all the cuts to CDC, the dramatic changes to HHS, the firing of different advisory panels. But I'm not going to start there. We're going to get there, but not quite yet. Here's where I want to start. Pretend for a second that it's November 6th, 2024, and that Kamala Harris had won the election. Elon, Doge, Robert F. Kennedy Jr., none of that had happened. I'm going to start with you, Dr. Cohen. What changes do you think America's health apparatus, specifically CDC, needed to improve its standing with the public whose trust it had lost?
Great. Well, first, it's great to be here, and I'm a fan of the pod. And so thank you for focusing on the topic of trust. I think it's super fundamental to the moment that we are in, not just for public health, but across so many spaces that we are in. And, I was the CDC director on that day, on election day and the day after.
That's right.
And so, what I would say is that during my tenure, which was short, so I came into the CDC after the COVID crisis. And, my role as CDC director very much was predicated on what I learned running the state of North Carolina during that hard time of the COVID crisis. And trust was central to what we thought about every single day. I had the pleasure of working for the best governor in the country, Roy Cooper, in North Carolina. But North Carolina is a purple state. We had a supermajority of Republicans in our General Assembly, and we very much, I think, are a microcosm of what the country experienced during COVID. And I think the reason I got the job as CDC director is because of how we navigated through that crisis with trust at the center. And so I brought that context with me to CDC. And look, CDC didn't, we don't perform perfectly in a crisis. And CDC certainly had areas that it needed to improve upon. And we were very clear about that. One was to make sure that we could strengthen our ability to detect health threats. And we don't know what the next health threat could be. It could be avian flu, or it could be something we don't even have a name for yet. So we had to do that. And then obviously to do that, we had to strengthen data infrastructure, our laboratory infrastructure, our response capabilities. And then look, we also had to improve the way we communicate. The way we all get our information now is completely different than what we did 10 years ago, all of us. We are in an attention economy. and the ways in which people get their information completely different. No one is just Googling CDC website for information, right? We need to think about different ways to communicate. And CDC certainly did not, do the best job it could in communicating during the COVID pandemic. So I came with that to the CDC. And so what we were on was the beginning of a journey. So on election day, I would have been like, yep, we're in the middle here. We're not done with the work we needed to do, which was to strengthen the CDC as the response agency that it needed to be to make sure we can detect and respond to any health threat. Now, that could be infectious disease. It could be non-infectious disease, but that we had the infrastructure to be able to do it, and that we could communicate with folks in a way that they understood it, and could take action on what we were sharing.
Thanks for that. Dr. Frieden, I want to ask you, or Tom, Mandy, can I say Tom and Mandy?
Absolutely.
Like those names sound like they're from Happy Days, like Tom and Mandy down at the sock hop,
It's like a Happy Days spinoff.
It's a Happy Days spinoff, Tom and Mandy. Okay, Tom, same question for you. It's November 6th, 2024. Bobby Kennedy, Doge, Elon, none of that had happened. You got Kamala Harris as president. What are changes that you would still like to have seen to rebuild trust that Americans can have for CDC in this country?
Well, first off, start with CDC and move outward. CDC itself needs to communicate with excellence. And you know what that means first? It means listening. You can't communicate effectively without understanding where people are. And it doesn't help to think of people as an undifferentiated mass. There are lots of different communities. Some of those communities haven't been isolated from or alienated from CDC advice. Some of them have. So to understand what concerns are, and then to see how CDC can try to address them, finding the right messages. What are the words that work? There's no magic key, but there are some phrases that are bad triggers, and there are some phrases that can have people willing to listen. And who are the best messengers? Because it might not be CDC. In fact, one of the mistakes that the Biden administration did, in my view, and I discussed this in my book, is to insist that CDC speak with the White House when it came to discussing COVID. And what that meant was inevitably, whatever it said, 40% of the country wasn't going to believe it. That was a big mistake. CDC is effective when it communicates, when it builds trust by listening, by addressing concerns of individual communities well, by finding the right message and the right messenger, and by having small wins. Trust is built by the dropper full and lost by the bucket full. It's not going to be quick to rebuild. When you have an emergency in a community, you can surge in doctors and medicines and ambulances. The one thing you can't surge in is trust. You have to build it. You have to earn it over time. And part of that means being really clear about our communication. What do we know? What do we not know? How do we know it? Of the things we don't know, what are we doing to try to find out more? And when might we find out more? All of us want like the clear answer. What is it? Tell me. To be able to say, of this we're confident. Of these, based on what we know now, this is what we think is the best path forward. So I think those are some of the principles of rebuilding trust. Communicate well, build confidence, learn well, listen well, find the right messages and messengers. But it goes beyond CDC. Part of the reason that CDC has lost trust is that a much wider swath of society has lost trust. Experts. You kind of run down the list of the groups that have lost trust. It's a large range. And one way of trying to rebuild this, and frankly, I think this is something that has strong bipartisan appeal, is improving primary health care. Making sure that people have a clinician, a doctor, a nurse practitioner who understands them, who they will listen to, who they can decide, hey, I don't want this vaccine, or I do want that vaccine. I don't want this treatment. I do want this treatment. I don't understand this that's coming out in the news. It is shocking, really, really shocking, that in this country, we spend more than $4 trillion a year. It's nearly 1 out of every $5 in our economy on health, and yet 100 million people don't have a primary care provider. nearly 1 out of 3 Americans. So I think there are things that CDC has to do better. There are also things that we as a society have to do better.
Let me ask you this, just sort of digging to like the core of why we're even having this conversation about the CDC today. And it takes us back to the pandemic. And just to do a quick poll for you, Tom and Mandy, would you say the CDC's response to COVID was fair, mixed, bad, horrible? What would you say? Tom, how would you?
I would say decidedly mixed. And I do want to go back to one pivotal moment. In February of 2020, Dr. Nancy Messonnier sounded the alarm, and the words she used really couldn't be improved on 5 years later. She was right on the mark. She was clear. She repeatedly said we have to be humble. We don't know how bad it's going to be. It could be really bad. This is the conversation I had with my family over breakfast this morning. We have to be ready for disruption. There are things that we can do. We're hoping it won't be a pandemic, but the sensible thing is to prepare for it. I mean, really, if you wrote that in a Hollywood script, you couldn't do better. And she was silenced, and CDC was silenced for the remainder of 2020. So saying they didn't communicate well is kind of like saying, oh, this person who had duct tape over their mouth didn't communicate well. It wasn't allowed to communicate. Now, that doesn't excuse mistakes that were made by CDC throughout the pandemic. One of the worst ones was the failure of its lab test. And that one really hurt because I was CDC director when H1N1 was a pandemic. The laboratory had created the DNA primers needed to do the lab test. It had manufactured more than 1 million of them within days and sent them to every public health lab in the US, more than 100 labs around the world. And years later, I would be traveling to countries that aren't friendly with the US. They'd say, oh, thank you so much for those primers. They allowed us to test for H1N1. So the lab failure meant that CDC lost credibility, but more importantly, it meant that New York and other areas were flying blind. When COVID was spreading very widely, there were thousands and thousands of infections before people knew that there were even one. And a large part of that was because of the failed test.
Yeah. And Mandy, what would be a word, you pick the adjective to describe? I mean, you show up to be the director, that Rochelle Walensky, deep dive into let's get it all on the table, everything we did wrong was probably sitting on your desk. What's the word you would use to describe CDC's performance during the pandemic?
Be a little more critical. I think it was fair. And the issue is, I don't think it was set up for success, right? So I don't think we had ever seen something like this before. It could never be CDC that could respond to something of this magnitude alone. And I'll just contrast that with like what we were trying to do in North Carolina. So I was the Secretary of Health and Human Services for North Carolina. Interestingly, I was not the state health officer, meaning I was not in charge of public health. My job was actually to coordinate across public health and mental health and Medicaid and social services, right? And what we recognized in North Carolina right away, this was going to have to be a whole of government response, meaning that it couldn't be just my public health department in North Carolina. It really was going to have to be everyone. And I think it took too long for that recognition to be understood across the federal government of that this needed to be a whole of government response. And thus the expectation that CDC could or should solve this alone was absolutely not where the reality was, number one. And so thus judging it right by that standard, I think is not accurate and fair. But to Tom's point, I think the first thing out of the gate, having that test be inaccurate was really, really challenging for CDC's reputation, that they could execute and that they could deliver, because we didn't have the opportunity to be wrong, particularly not in the beginning. And so I will just say as CDC director, we made an enormous change in how we think about our laboratory work and how we partner. CDC still needs to be great at developing diagnostic tests for super rare things. No one else is working on it, and they are excellent at it. But you know who's great at scaling tests? The private sector, right? So the industries that run big commercial labs. And we need to partner differently. And so we actually do. We now have formal partnerships right now that are sitting there, what I'd call warm partnerships, right? They're not activated all the time because we're not in a crisis, but you can't activate those quick enough from nothing, right? So you need to keep them a little bit warm so in a crisis they can go on really quickly. And so that is a different kind of relationship that CDC didn't have before, and we've learned our lesson that those are the kinds of relationships we need. Yeah. The one place I think Tom and I, disagree on, I think in a time of crisis, it is important for your elected officials and your knowledgeable public health experts to share the stage. Because your elected officials are the ones that are going to guide the populace, right? They are your leaders, but it is important that those leaders share the stage with folks who are the experts. To Tom's point about Nancy being the expert in that moment, and so I do think what I was very lucky to work for an incredible governor who shared the stage with me. To be able to communicate to North Carolina. And I think that very much changed how things were approached. But it wasn't me alone, right? Because I also think me alone would not have worked, because I do think in a crisis moment like that, you need both the elected officials and the experts together working as one team. And I think we saw in 2020 folks not working as one team.
Tom, react to that. What do you make of that?
I think you absolutely need alignment between the political leadership and the technical expertise. There's a lot of misunderstanding about what the role of a technical agency like CDC is. CDC doesn't and shouldn't set policy generally. CDC should inform the policymakers of the choices and the implications of those choices. Do this and that will happen. Do that and this will happen. There are areas where CDC does provide guidance, what antibiotics should be used for what infections and how we should track hospital-based or community infections. Those are very technical issues. But policy issues should be set by policymakers. I think the issue Mandy's raising is really an important one. You want to have alignment. And part of the challenge is, I'm a doctor, not a politician, but my observation is that in this country, things have become so partisan, and used to say that you're entitled to your own opinion, but not to your own facts. That seems, so 20th century. Now people seem to be entitled to their own facts. There are a lot of things that we're not sure about, and we should be honest about those. There are other things that are plain and simple facts. That doesn't mean they lead immediately to a decision, a policy decision on what to do. Follow the science is actually a very misleading idea. Follow the science to get to the facts, but not to get to what we should do. That's a personal or political or community-wide decision.
Let me just bring us sort of towards today and all the changes we're seeing. I went back and I looked at what Project 2025 wrote specifically about the CDC. And a lot of people are looking back at that document and saying, a lot of this is true now as we move month by month into the Trump administration. So the authors of the report wrote, COVID exposed the CDC as perhaps the most incompetent and arrogant agency in the federal government. I'm just wondering if you hear those words and sort of the intention of those words, and you look at what's sort of going on for CDC now and the changes that are being brought upon the agency, what do you think is really going on here? Like, is it reform? Is it dismantlement? Is it improving public health? Is it changing public health in a way that sort of is minimizing public health? Mandy, maybe start with you. What do you think is really going on here?
Well, I think there's a lot of things going on, and not all of them are good and not all of them are bad, like anything. I think that we were on a path after COVID to learn some very important lessons about what CDC needs to prioritize and focus in order for it to be the kind of agency that we needed to be to protect health and improve lives. And that did mean it needed to be a different kind of organization. It was an incredibly siloed organization, but we needed to have better data infrastructure. It was siloed from the private sector. I was just mentioning the lab partnerships. We needed to communicate differently, as Tom said, and there had been a lot of improvements. Now, was it perfect, as we were talking about on Election Day? No, it wasn't, but we were on a trajectory, and the reason I know we were on a good bipartisan trajectory is because trust in the CDC was measured. And we all talk about how trust was lost. Trust went back up during my tenure of CDC. And again, I think that was because of the pragmatic work that we were doing to learn lessons and taking action on those lessons. Now, what I see now, I think if they had continued on that track, that would have been the right way to go. And of course, any new administration, you're going to have new priorities. There's going to be changes in leadership. That is very normal. I think that the few things that were like very abnormal about what we're seeing now, one is the way in which, like the how that they did their work, the cruelty, the speed, the lack of intentionality, so that you didn't understand the consequences of decisions and you said, oh, oops, my mistake, and we had to refix it. Like, why did you have to cause that chaos? We're as I'm sure Tom would say, you cannot have the ethos of move fast and break things when human lives are at stake, which is what the work of the CDC is. And so you have to be intentional. You have to understand unintended consequences. It doesn't mean don't change. It just means be thoughtful about it. That's one, is the cruelty of sort of just how and folks not actually being rigorous about making those changes in a way that makes things better. But then second is fundamentally about that I don't think was captured in 2025, but is really more about what I'm seeing from the secretary and his team, Secretary Kennedy, is taking away some of the expertise, the outside independent expertise with on things like vaccines, right? And so that it feels like crossing into a space that we have not been in before. That makes me very worried and uncomfortable, and that you are seeing, whether it's the infectious disease societies or other medical associations say we are in a very abnormal place regarding vaccines and how we think about science, and that we need to make sure is addressed, because I am worried that it is further eroding trust in the CDC at a time where we need to rebuild it.
Tom, what do you think when you step back and connect the dots? Like, what is going on?
Well, there's a lot going on. One of the consistent and consistently wrong narratives is that CDC blew it in COVID because it was distracted with all of these non-core issues. And if we limit CDC to just infectious diseases, it's going to do a better job. It sounds good, and you hear it spoken by lots of people, and it's a prominent part of Project 2025, but it's really importantly wrong. CDC exists to protect Americans from threats, whether those threats are infectious or non-infectious, whether they're from this country or anywhere in the world, whether they're intentional or man-made. And CDC won't be able to protect Americans effectively unless it can protect from that range of threats. One of the things that the current administration did was immediately eliminate the lead poisoning prevention program. And when Milwaukee, Wisconsin said, hey, we need help, we've got a lead poisoning problem, it was, I believe, likely the first time in the nearly 80 years that CDC has existed that it couldn't respond to a request from assistance from a state. You can't protect Americans' health by limiting to infectious diseases. While I was director, the Zika virus began causing terrible birth defects around the hemisphere. And that response was incredibly complicated. We had to have people who were experts in mosquito control, experts in birth defects, experts in reproductive health, experts in creating disease registries to track people over time, experts in laboratory testing, because it's a complicated laboratory test, experts in immunohistopathology to be able to look at what was actually happening in the brains of children who died from that disease. So you can't protect Americans effectively unless you have a comprehensive protection. And that, to me, is the single most concerning thing I'm seeing thematically, including things like eliminating the tobacco control program, This is a program that has helped millions of Americans stop smoking. It's the only part of the federal government that tracks tobacco trends, tracks what the industry is doing, tracks and supports community-based comprehensive programs, sees what new products are coming to the market. Sure, the FDA has an important role. It regulates products. The CDC protects people.
Tom, let me jump in, though, because I think this is an important point. What you're saying is, in fact, what we hear from a lot of our listeners, this point that Kennedy made about how the CDC should be sticking to epidemics and infectious diseases. I want you to really make the case hard that CDC, it's in its name, right? Centers for Disease Control. Make the point. Try to convince me that this is an organization that cares just as much about chronic disease as it cares about infectious disease. Because I will say the impression amongst a lot of people we talk to is that, there are these disease investigators that are launched in the middle of a measles outbreak. Like, it's what you see in Contagion. It's what you see in, like, during the pandemic, right? That's when you hear about CDC. You don't hear about CDC when you're talking about obesity, when you're talking about diabetes, when you're talking about health equity. And in fact, is it too much for the CDC to take on every single health issue in this country?
It's not every single health issue, but it's the health issues that are most likely to make Americans sick, disabled, or to kill them. I'm an infectious disease doctor. I worked on tuberculosis for many years in the US and around the world. I was an epidemic intelligence service officer at the CDC. It's a wonderful approach. It's an approach that is essential for lots of problems, not just infectious disease problems. It's an approach that allows us to see the invisible, whether that's lead poisoning our kids or the next generations of toxins that are just now being identified, by whom? By CDC, because of something called the National Health and Nutrition and Examination Survey, or NHANES. That's how we know endocrine disruptors, nanoparticles, microplastics. This is how we can learn what's happening. This is what led to fortification of bread and salt, so we don't have severe birth defects. CDC works best by doing things so you don't have to worry about them. And that might be infectious diseases from safe water or effective vaccination programs, or it might be protecting from toxins or deficiencies. CDC at the turn of the century put out a very interesting document, 10 Great Accomplishments of Public Health. And it talks about how public health has saved millions of lives, prevented disability. 8 of those 10 don't have anything to do with infectious diseases.
Brendan, maybe I can jump in here too on that question. I think it's a matter of when is CDC the quarterback and when is CDC a team, part of a team player? Maybe they're on the offensive line, okay, to go with my football metaphor. And so in an infectious disease outbreak, whether that's international or in our backyard, CDC should be the quarterback. They have the expertise. We've built up our data systems, our response capabilities. They know these pathogens inside and out. So they need to be the quarterback. And I think that's why there's movies made about it, like Contagion. Now, there are really other important health threats that Tom's talking about. Maybe I'll take even another one, opioid crisis, where CDC is not meant to solve the opioid crisis alone, but it has, to Tom's point, an approach, a way of collecting data that can surface problems so that we can map appropriate solutions to them. And no one else collects that data, right? So the health system is very involved in treating the opioid crisis and identifying folks and helping them get access to treatment. But no one thinks about the whole. How do we know where are overdoses happening in a particular city so that we can share that data with law enforcement and that we can actually be more surgical with our approach and our resources? No one does that other than the CDC. And so I'm not saying CDC needs to solve opioid crisis. And in fact, no, it's an offensive lineman or whatever for the work. It's not the quarterback, but it absolutely needs to be at the table, particularly because of that approach that Tom was talking about, that data that we can bring to say, here's a problem, and it's here in your city. Not just it's here in Chicago. It's like here in this neighborhood, this zip code, and let's be surgical with our resources and let's map all the best solutions. And oh, by the way, we can evaluate what those best solutions are so we know what to spend our money on because we don't have enough time and money to waste here. So I think think it's a matter of like, where is CDC best positioned? And it's not always as quarterback. So anyone who thinks CDC is going to solve all of obesity, it's not. This is a team sport, and public health is that. But does CDC have an important role to help understand the problem and map solutions? Absolutely.
And opioid overdoses were going down in the last couple of years.
That's right. We were seeing decreases in opioid overdoses, which was fantastic. Again, that is not CDC alone, but it's CDC data that's helps us understand, are we making an improvement or not? Does that mean we need to make a choice? But SAMHSA, Medicaid, commercial insurance, like so many folks were involved in making that law enforcement. It wasn't even in the health space that
Mandy,
helped make that possible.
That point about data collection, I think, is really vital for our listeners in particular, about like really understanding what different agencies do and maybe getting a little bit like, why do we need one agency to do all of these things? And I think that point about data collection really does need to be underscored, that is a very particular function of the CDC.
Absolutely. And you know,
we have to be great at it.
Just to add to that, in 2010, when I became CDC director, it was extremely clear that opioids had become a crisis. And we sounded the alarm. We worked with communities. We worked with the federal government. There's a lot more I wish had been done. But CDC was there to say, this is a problem. This is where it's hitting. And we could see as the pattern changed around the country, we could then turn on systems using emergency department tracking to know where the overdoses were. We could foster local connections between law enforcement and public health to figure out, how can you shut down supply chains? How can you support people who are addicted better? And when we realized that there was nobody else who was going to provide a non-conflicted set of recommendations on how to treat chronic pain, our injury center produced those recommendations. Non-conflicted, not easy, because turns out the pain industry, the opioid industry, had infiltrated the healthcare system. So we were super careful, and we were attacked. We were threatened with lawsuits. They were groups that are sometimes called AstroTurf. They pretend to be grassroots, but they're actually paid for by industry, that were trying to block us. But what we were basically doing is saying, hey, look, stop for a minute. In this country, we don't do a good job treating pain, and we don't do a good job treating addiction. And though it may be really easy to write a prescription for opioids, there needs to be a rigorous, fact-based set of recommendations that doctors can rely on to use these medications, which have a very important role, safely, so they don't result in more deaths.
I do need to just take a step back, because we need to move forward in this country. And I know that the two of you, I got word that the two of you are on a group text chain with all of the other CDC directors. Can you confirm that, please?
Not true. Not that I'm aware of, anyway.
All right, but let's pretend that you are.
Pete Hegseth's on it.
Pete Hegseth is not on it anymore. But let's pretend you're all on this like Signal chat. And Dr. Menares was just added to the Signal chat. Okay, she is ready to go. What are you texting her, Mandy?
Well, one, to say, open door anytime. These are tough jobs, and the experience that you get in these jobs, I think, is invaluable. Tom, was a constant source of advisor for me, as was Julie Gerberding. Frankly, I think I met with every living CDC director that was there, because I knew how valuable it was to get experiences that folks had before. So one, it's open door anytime. We want to see you personally and the CDC and its work succeed. And if there's any way we can help, we want to be. And I know Tom would say the same. The second is make sure that you're investing in the core infrastructure. It's not sexy, right? The data, the laboratory work, the workforce, and the response capability. The third thing I would say is be kind to those incredible experts at CDC. Does the organization, of course, always need improvement? Yes, but there are so many experts doing things there that no one else does. And so to really value and appreciate that expertise, and to ask them to be part of this new world, right? Because the world has changed. The world is not the same that it was in 2020. We are in a different world, and we as individuals and we as an organization, CDC, need to change. And I think you can do both, but you have to treasure that expertise as you're asking people to change.
Tom, what are you texting?
First and foremost, open door. We're all rooting for her success.
But what specific advice? Sorry, let's get specific. What specific advice are you telling her in this new climate that we need to do? Like, besides, like, we're here for you and all of that stuff.
So first off, conceptually, I summarize it as top: technical, operational, and political. You have to get all three right. You have to make sure that you're technically tops. And there are fantastic people at CDC. A new article comes out, you read something in the newspaper, you can call the person at CDC and you're talking to one of the world's experts in that area, almost any area of health. Operational management, a lot is about good management. CDC succeeds when it manages well. And political, you have to be able to manage Washington. CDC is in Atlanta, and that's an advantage because you're a little insulated from politics, but it's a disadvantage because when decisions are being made, or budget decisions or policy decisions, you're often not in the room. So you have to manage those three things. I would give one other very specific piece of advice, which is to renew CDC's focus on supporting states and local governments. That this is something I know Mandy made progress on. I've tried to make progress on. When CDC started, it was very clear it exists for state and local health departments. And in fact, 2/3 of its budget goes out to state and local health departments. But there is too much of a gap. And that means you have to bridge that gap because most of the work gets done at the state and local area. And I'm not talking about CDC imposing its policies and perspectives on state and locals. I'm saying it needs to be a joined perspective. In one community, algal blooms are a huge concern. In another community, it might be air pollution. In another community, it might be the lack of access to health care. But you have to be able to understand that ground reality. And one last point. The man who founded CDC wrote that he thought everyone who goes to CDC should have first spent a year as a county health officer, long enough to have proposed a budget and gotten it through the county management. And I think Mandy and I share having been at the state or local level before coming to CDC, and it really is important to reduce that gap between the federal government and the state.
I totally agree with Tom. Like, all of this is local. Just like healthcare, public health is also local, and having that experience is critical.
I'll just add that one of your fellow CDC directors who would be on your fictitious text chain, Robert Redfield, called for the headquarters to be shifted from Atlanta back to Washington, or up to Washington. So I'm not sure about the distance and having to bridge that political gap. It seems like there's some that are calling for it to become more a part of the nation's capital and the political center.
Being someone who was the HHS Secretary for North Carolina, right, it was my role to bring a siloed organization together. And I think that when you are able to do that, you really can solve problems in a really unique and important way. So I understand the idea of it. Look, we're Zooming now. I think like geography matters, frankly, more for the director, because I'm sure Tom, I was on a plane constantly, both to make sure I was present in Atlanta, but make sure I was present in DC. I was on the Hill a lot trying to help folks understand what we were doing and why. And importantly, I was out in our states and localities. And anytime I was traveling, I made sure to do local news so that folks could know me and know our work, because we all know that trust fundamentally is about being human. And so I felt like that was really important. So those, yes, I understand like the geography, but I think as long as you get it in concept, right, which I think he is saying is like we need to work as one team more closely. Absolutely. And I want to see prioritization between the NIH, FDA, CDC, and others as we think about, well, what are the investments we need? What pathogens are we most worried about? And are we systematically developing the tests we need? Are we systematically developing the countermeasures that we need to those pathogens? Because each of us have a different piece of that. NIH has a big piece, FDA does from a regulatory, and CDC. CDC from a response. And we all see that elephant from different perspectives, but we need to be more one team.
When I began as CDC director, a wonderful former director, Bill Foege, and I were speaking on the phone, and I said, I'm just not going to go to Washington. I'm going to focus on really strengthening CDC in Atlanta. And he said, oh, yes, you will, because you have to go to Washington to defend CDC. And in the nearly 8 years I was CDC director, I made more than 250 trips from Atlanta to Washington. I met repeatedly with both houses of Congress, members of both political parties, the administration, the White House, HHS, other agencies. So you have to have a Washington presence, and you have to have a critical mass of people able to do the research, the tracking, the projects that keep Americans safe. That's what CDC is about.
I'd like to think both of you just inadvertently made a little love letter to Atlanta and what you're both saying right now, which is, shout out to Atlanta. Great city, great city. Let me ask you guys, let's shift to vaccines for a second. So clearly Secretary Kennedy has already made plenty of changes on the vaccine front. He fired the old ACIP committee. He now has a new one. He has talked about major changes to COVID-19 vaccines for pregnant women, for young children. He's now talking about the VAERS system, the Vaccine Adverse Events Reporting System, and potentially removing the liability shield for pharmaceutical companies. I want to get your sense, like from what we hear from people who do talk about vaccine adverse events, and we do make space for those stories. Do you think that some of these changes are necessary? What do you think is necessary? And then what concerns you about what you're hearing? Why don't we start with Tom on that one?
I have to start with the concerns, because what I'm seeing and hearing is frankly horrifying. 93% of American parents get their kids vaccinated. There are groups that are concerned about or don't want to get vaccinated, but the secretary has been calling groups like the American Academy of Pediatrics a special interest groups. Well, if they're a special interest group, their interest is our kids' health. These are our pediatricians. When Secretary Kennedy recorded a message for Gavi, the Vaccine Alliance, I was horrified. He was repeating things that are untrue. He was making statements that are false, demonstrably false, and that will have concrete implications in spread of infection and childhood illness and death. Now, having said that, there are things that need to get better. Communication about vaccines needs to get better. I believe that one of the mistakes made during COVID were vaccine mandates. Once it became clear that the COVID vaccination primarily protects the person vaccinated, not so much the people around them, the case for mandates got massively weaker. Also, the vaccine injury compensation program, it's 40 years old. The compensations were set when the Berlin Wall was still standing. So there are things that need to be modernized. It doesn't have a rapid response, but the overall issue is very concerning. I was around and working on measles when the vaccine manufacturers were getting out of the business because they were getting sued for things that their vaccination did not cause, but they might lose their business on. And the risk of throwing the courthouse doors open and having, look, I'm at best a mixed fan of the pharmaceutical industry. There's some great innovations, but they're ripping us off in terms of what they're charging us. So I don't think they should get a free pass. I also don't think they should be exposed to lawsuits that might cost them millions or billions of dollars and that are unjustifiable. Now, there are 1 in a million reactions that happen that are bad. And when that happens, people should be promptly compensated for it. But if you end that system, what will happen is instead of a reliable way that should be more reliable and quicker for people to get compensated, you'll have kind of a jackpot system where trial lawyers prey on personal suffering to try to shake down the vaccine companies because they've got the deepest pockets.
Mandy, is VAERS missing a big problem or a bigger problem with vaccine injury in this country just simply because it's a sort of a poorly promoted, difficult to use, de-incentivized to use database or a way to reach out and say, I've got a problem? Like, is it antiquated? Is RFK right to take that on and say, we've got to overhaul this?
First, it's not the only vaccine safety data system that there is. I think there are 5 or 6 of them, and it's important to understand that each of them have different jobs, right? So VAERS is meant to be a screen-in kind of thing, right? Someone has something, they put it in, but we don't know the denominator. I'm sure we're missing some things. I'm sure we're overseeing some things. But it is meant as a screener. But then we have other vaccine safety monitoring systems, not just even at CDC, but also at FDA. So you have 2 agencies that look at safety both before they go on the market and also after they're on the market. And look, we want to be looking for signals. And I will tell you, our teams see them and then they look deeper and they keep looking deeper. And as someone who got the Johnson & Johnson COVID vaccine, which, as you know, was stopped very, very soon, they are able to find needles in a haystack, meaning 4 or 5 cases of clots and saying, nope, we're done here. And I was one of those people who got that vaccine. I got it on TV because, but then we have new information and then we say, no, but my point is like those systems were able to pick out that needle in a haystack and say, there's a signal here, but use good scientifically driven evidence-based techniques, mathematic techniques, not anecdotes, right? Because that is not how we do scientific research, right? We need those rigorous systems. Now, that all being said, do the systems need to be better? Absolutely. And that's where all that data improvement that I was talking about, I definitely think could be better. The CDC and FDA systems could be linked together. So there's definitely improvements. If we want to talk improvements, love that. But are they finding the safety signals? Yes, they are.
We have these systems for vaccine safety, but we've still seen the numbers of people getting vaccinated drop down. I'm thinking about measles right now. I work on it. It's ever present. But because we're undergoing this spike in measles virus cases, in a way we really haven't seen in a generation, can Americans trust what's going on? Is the CDC up to the job?
Well, first, it really goes back to state and local areas. The CDC supports most of the vaccination or much of the vaccination work that gets done, but we really are at risk. If the health secretary continues along the lines that he has now, half of American children could lose access to free vaccinations. CDC provides about half of the childhood vaccines in America through local pediatricians through the Vaccines for Children program. That's a bipartisan program that makes sure that vaccines aren't for the rich, they're for everyone. But that program only pays for vaccines that the Advisory Committee on Immunization Practices recommends. So there's a real risk here. There's a real risk that our safety net, our protection, will be shredded. And it worries me. I'm given reassurance and confidence by the fact that there are really great state and local health departments, pediatricians, community groups, 93% of American parents. But measles, because it's so infectious, it's able to pinpoint weaknesses in our system, weaknesses in parts of the country where there's a trust gap, weaknesses in healthcare access where people just don't have access to vaccines. Vaccines have amazing benefits, reducing the risk of hospitalization, of death. It's even possible, though not certain, that the shingles vaccine reduces the risk of dementia. There's growing evidence that suggests that. There are vaccines that prevent deadly diarrhea and more vaccines potentially coming out. The irony is that we're living through kind of a golden age of vaccines. There are new vaccines that are safer, that have fewer antigens that have to be injected, that are given orally or in other ways that are less intrusive or invasive. At the same time, we're seeing forces that could undermine our ability to protect people in this country and around the world.
Trump fired the head of the Bureau of Labor Statistics. I'm just wondering what your guys' thought is coming from the CDC, such a hub of statistics, of data. Are you guys worried about scientific data becoming more and more politicized. And if that happens, and it could happen under either party, let's just be open about this. Like, isn't that the whole game? Like, isn't that the whole house of cards falling? Like, if we don't believe the data, how do we move forward to protect ourselves?
I think that's right. I think that's actually right. Thanks for mentioning my book, The Formula for Better Health. The formula is see, believe, create. Public health is at its best when we see and help others see the faces and the lives behind the numbers. Public health can see the invisible, but only if we have real data. Only if the data shows where there's illness, where there's risk, where there are problems, where there's progress. And if we lose the ability to track where health is going, it's like a doctor trying to take care of a patient when you don't know their pulse or blood pressure or temperature or electrocardiogram. It's flying blind. It's going back to an era where we just guess at what might help people rather than base our actions on facts.
Okay, final question. The name of our show is Why Should I Trust You? Many of our listeners are very supportive of Secretary Kennedy's vision, who really believe in Make America Healthy Again and are ready for change. Why should they trust you if they view you as someone who's perhaps part of an old guard or partisan because you worked under a Democratic president or have been public in your concerns about the Secretary's visions? Let's start with Mandy. Why should our listeners trust you?
Well, first, I think that I have been a very bipartisan, pragmatic leader in a number of spaces, working in North Carolina with a supermajority of Republicans and a Democratic governor. We needed to find pragmatic solutions that made sense for our state. And it's why I'm proud 99% of our seniors in North Carolina were vaccinated. It's why I was proud that every single elected senior official in the legislature, Republican and Democrat, did a vaccine ad for us during COVID. It's why we also ran our big NASCAR race in May of 2020, because we love NASCAR in North Carolina. Like, we had to find a way forward, but those were outdoor activities. And I was like, go for it, go run, go race outdoors. Right. So like, we found pragmatic solutions that we could work on together. I don't think we always agreed, but we had mutual respect. And I carried that into my role as CDC director and even into the work that I'm continuing to do now, is that a respect that we're all coming from things in different ways. But if we focus on pragmatic solutions that matter for real people's lives, like that is where we can find alignment. And so why folks should trust me is because I build relationships and across aisles. I'm transparent in how I communicate, and I'm focused on results.
Tom, why should our listeners trust you?
Well, make your own decisions. You decide. I'm a doctor. I worked with Democrats and Republicans. In fact, many of my closest collaborations while I was CDC director were with Republican leaders in the House and Senate, creating new programs or improving programs. I have never taken a penny from pharma, and I never will. I do my best based on my training, my knowledge, my experience caring for patients to understand what's hurting people and to understand what could change that. That's why I created my group, Resolve to Save Lives. We work around the world with the goal of supporting communities to prevent 100 million deaths over the next 30 years and make the world safer from epidemics and pandemics. I don't think I know everything. I think you know you better than I know you, but together we can make a healthier future for you and for everyone.
Well, I just want to thank Dr. Mandy Cohen and Dr. Tom Frieden, two former CDC directors, for our CDC-palooza. What are we going to, 3 directors, 4 next time? Let's round them all up. It was really wonderful to chat with you both. Thank you for coming on to Why Should I Trust You? To our listeners, this was a real treat. And please send us questions, comments to questions@whyshouldItrustYou.net. I am Brenda Akari. He is Tom Johnson. She is Dr. Maggie Bartlett. He is Dr. Mark Abdul-Malik. Thank you, Mandy and Tom, for joining us.
Thank you. It was a lot of fun.
And we will see you all right back here next week.